Welcome to Take 5 an Inventory series, where we leverage our power to get every piece of healthcare news we deserve. I'm Alex Diamond, and I once again asked Hayes Waldrop of the Council of Supply Chain Executives to sit down with me. Based on his conversations with procurement professionals at every level, I asked him, how has the coronavirus crisis changed supply chain's approach to sourcing, and how has it changed the overall hospital's approach to the supply chain?
Well, as far as the sourcing strategy, from what I'm hearing and the folks that I talk with, clearly they're changing it. Their strategy. Typically it used to be, the buzzword, the trend. It was the just in time delivery. Having as few SKUs on the shelf as possible, maybe having 3, 4, 5 days worth of inventory. That's changed. And I think many of them are going to stockpiling or literally building more warehousing. They're going to start. Most of them are telling me that they're interested in clearly the best price, is China or international. But then they're doing nearshoring and, literally domestic product. They realize that domestic costs more, but they kind of look at it in a dollar cost averaging scenario. They know that, we'll buy a little bit here at this amount, but we know it's, here in the States. And so it has changed the way they think. And I had this conversation earlier today. Supply chain, they've been elevated within their system of importance, and which I think is a great thing. And if they didn't have a seat at the table at the C-suite, they're getting, at least their voices are being heard now. In the conversation I had earlier today, one of the guys said that the chairman of the board knew exactly the name of his supply chain exec. He goes, he never knew that before the pandemic. And I think that's really, really good for supply chain execs all across the U.S. I mean, I did a good job because they did everything they could. I mean, when you're, if it's not available, it's not available. As one of them told me, he says, during the middle of it, say it was March, April, he goes, Amazon wasn't delivering product either. And so he goes, they're really good at what they do. He goes, so we get it. He goes, ours is more important. He goes, but we get that, they're trying to do everything they could do. I was told of stories in manufacturing facilities in China. They were literally reps from other countries in the lobby with cash, and they were trying to circumvent everything else. And so, they were literally bidding against the world. And so it's, to me, no one's to blame there. I don't think. I mean, I think we just didn't see it coming. So to the point of whatever the supply chain execs think they need, I think they're getting it. In fact, HCA, I think they came out and they made the proclamation that they're going to build or use a warehouse in Florida, and they're going to build up a supply of 6 months of PPE, enough for all of their facilities. And I think the quote was, this is never happening to us again. I think that's exact quote. And so, yeah, they're all changing their strategy. And I think obviously you got to be smart about it. You can't buy a ton of product that expires. That's ridiculous. But I don't think anybody's in that point yet, because there's not enough supply to actually stockpile it. They're still waiting for it to come in, catch up. Most places that I've talked to, they feel confident they've got enough, but not enough to stockpile. And so I think the sophisticated systems, they know their turns. They know when it expires. They'll be able to get that stuff in and out. But I do know hospitals were going through in 30 days during the pandemic, what they were doing an entire annual usage last year. And so, I mean, there's no way you plan for that. And so I do think they're going to stockpile. They're going to get more than they probably ever need. And they're going to have to some of them are going to get caught with expired stuff, but most of them I think are going to be wise enough and hopefully sophisticated enough that they'll watch those turns, and that won't be an issue.
That's all the time we have for this week. Listen again next week as we prepare ourselves to talk about emergency preparation. Take 5 is a production of Z5 Inventory. To see all of our sources and resources for this episode and more, visit z5inventory.com. That's the letter Z, the number 5, and the word inventory.com.